Hi, this is Ian Wright, and this is part 4 of learning issues and the management of learning issues in children. And in this one, I'm just going to give a little bit of an introduction to some of the developmental dyslexic conditions. And the reason, I suppose, why I'm talking about them is when I'm treating, it would take too long to describe almost what we're doing, why we're doing it, the processes involved, and what some of the issues that are involved with it are. Because it takes time to go through this. And this is, even though this is not an in-depth study that I would give, say, if I'm teaching students, it's an introduction. So developmental dyslexia, as opposed to acquired ones, which come from, say, brain injury, which we're not going to talk about here though in adults. We're going to talk about developmental ones, which are there for not really any obvious or clear reason. There can be a little bit of a genetic component, etc., but we'll talk about that. Is a difficulty really in the fluency of reading and spelling, despite intelligence. So this is nothing to do with intelligence at all. This is a particular difficulty that comes, and some of the most highly intelligent people in the world, including Einstein, had dyslexia. So it's nothing to do at all with intelligence. Actually, as I'll talk about later, it's actually more to do with the way that we learn, and some people, I think, learn differently. Anyway, we'll talk about that. But this can include spelling, writing, reading from the board. It's actually the most common learning difficulty and affects up to, say, 7% of the population. But actually, interestingly, up to about 20% of the population would have some symptoms of it. So not the total thing, but some mild elements of it. And historically, it's been diagnosed certainly more in boys than girls. I think there's some modern studies are actually saying something different now. You have to differentially diagnose this with, number one, which is an obvious one, poor teaching. So you've got a child who's having difficulties reading and writing. I mean, they not be taught very well. That has to be ruled out straight away. Eye issues, because there's often a visual processing issue, and they could have a primary eye issue. So you actually always have to get your eye, the child's eyes checked. Now, they could have something a little bit more deep, like a core processing issue or a global developmental delay, or a dyspraxia. Or there could be an intellectual disability, which is a whole different subject as well. So those are the things you almost have to differentially diagnose if you're trying to come to, I think, to a diagnosis of dyslexia. But having said that, as we talked about before, it commonly links up with other issues like ADHD, developmental coordination disorders, sensory processing, and especially some of the dyscalcular type situations, which is difficulty with mathematics, or dysgraphia, which is difficulty in writing. So, and especially other areas called like audio processing disorders, which are very much linked with dyslexia, and they're to do with having difficulties so for example, when the teacher's talking at the front of the class, your processing is very difficult. So sometimes it's very hard to discern them, and they cross over, as we've said quite a lot before, a lot. But some of the issues that you have with the dyslexia is obviously languages, different types, different elements in the languages. And also a very important part of it is difficulty with short-term memory. And there are two main threads in it. One is more to do with language processing, and the other is more to do with visual processing. So you have to kind of discern what area, and there's a whole variety of different actual dyslexias that are diagnosed when you break it down into particular difficulties, like difficulties with the phonology and other type core dyslexias and surface dyslexias, and there's a variety of dyslexias which we're not going to go into. It's not really relevant. But how do you first notice that your child... I actually, two of my girls had different degrees of dyslexia when they were young. And I'll talk about those later. But how you see it, first of all, is a delayed onset of speech. It can be, not necessarily. It doesn't have to be at all. It may not affect speech at all. But they can often have a lack of phonological awareness, meaning they have difficulty with rhythm, with identifying rhyming words, or they're easily distracted by background noise. So when you first see it, it's when children start learning to read and write, and they can have difficulty with rhyming words or counting syllables, or segmenting words, breaking them down. So when you're trying to teach your child some of the basic rhymings, or breaking words down, or even word retrieval, you start to see some difficulties. And often we notice them in relationship to if one of our children has it, it's like, well, actually, the older child maybe, or the younger child found it a lot easier to do so. It tends to get picked up sort of between 5 and 7 years old, more at school, and the teachers tend to pick it up actually mostly. As I said, it can cross over with other areas. Like one of my daughters who had dyslexia has had a dyscalculia, which was actually a difficulty with numbers and connecting and seeing and processing numbers, and that was quite difficult for her. And dysgraphia, which is a difficulty writing, but then that could be to do with coordination, which is what we've talked about in the previous one. There's an interesting crossover between ADHD, because 35% of ADHD children have some sort of diagnosis of dyslexia. Now, which comes first? Because if you have a difficulty in reading and writing and auditory processing, say, you can have a difficulty in concentration. And we're going to talk in the next one about ADHD, ADHD. And there can be a difference. And so sometimes it's very hard to discern which comes first. And I will talk about that more next time. So, what is actually happening? Why is there a problem? So it's really fairly unknown in terms of medical science. Even now with functional MRIs, they have found some particular issues especially with the left side of the brain, the left hemisphere, a possible difficulty in the bottom of the frontal lobe, some connection, the way the frontal lobes connect with the cerebellum, which is to do with coordination, so there can be some cerebellar issues. There's been other studies that have shown that the development of the microgyri, which are the kind of when the brain creates these kind of ridges and these valleys and mountains almost within it, these tiny little ones within it, around 6 months as the brain develops, have some abnormality. They've seen something like that. I'll talk about it from how we would look at it. This is absolutely a personal view, so please don't say that this is the truth. This is a truth. This is my view on it, that I've spent the last 20 years working with children with this. And in some cases, there seems to be a left-right imbalance in the way the nervous system moves. We're interested, when we're working and trying to understand this and sense and feel this slow breathing movement of the nervous system as a whole. And you can detect left-right disharmonies. So it seems like they almost like the nervous system on the left and right-hand side can be slightly out of phase. The laterality is out, which, interestingly enough, when you say, for example, you have visual or auditory processing, what happens is the stimulation, as in what you hear or what you see, comes in one side of the brain, crosses over to the other side of the brain to get processed, mostly. So if there's this sort of slight disharmony, and they normally cross over to part of the brain called the corpus callosum. If there is, but it's not quite as simple as that, but there is this left-right connection that's needed in terms of sensory processing, as in things you take in with your senses. And so sometimes there can be this left-right discrepancy, what we would call often lateral strains of the cranium, which can be connected to birth difficulties. Actually, I think can be genetic. You can see it running through families. Now, if they've got a certain brain head shape function, is that because these babies who are siblings actually sit in the mother's pelvis in the same way, etc., etc. Very hard to discern sometimes things like that. But in the end, what you can feel are certain imbalances, functional imbalances. And what we like to do as osteopaths is try and get them balanced and getting everything. It's very simple, really. We try to get everything moving in harmony. And the more you can get this kind of lateral harmony, it can improve and it can help. So there's a lot of children we've been treating for many, many years, and you treat occasionally or through exam processes, or actually when they grow, they go through growth spurts, so you get everything functionally aligned almost. And interestingly enough, sometimes kids with dyslexias can have slight imbalances of the way they, say for example, they hold their head and neck off to one side, and they're not quite straight. And if you look at them standing from behind, and it's interesting to look at your child, and when I do this in practice, it's fascinating because I'll show a parent, often when we're treating, I'll show a parent how the child is standing, first of all, before treatment, then I'll show them afterwards to show them the difference when they straighten up. And often parents haven't noticed that their child is quite offline until you show them at the at the beginning, and then they go, actually, you're right. He does actually hold his head off to the right or the left, and So basically, often what happens is that if things are not quite structurally aligned inside, you tend to adjust your posture to keep your brain straight. So what we have to do is try and keep everything, the alignment. And actually, it's interesting when you treat stuff in the head, the whole body can come into alignment without you even touching the rest of the body, which is a fascinating kind of side effect almost. It's like, you treat what's going on internally, and the side effect is they straighten up posturally, which is, I think, is a rather nice way of looking at it. The other side that I think that's really important to talk about with dyslexias is frustration, stress, anxiety, feeling different from other children, struggling when they don't feel that they can perform in the same way. It's a huge subject which I spend a lot of time with my own children and with other children who find it very stressful that they can't perform in the same way as other children when they are super intelligent mostly. These kids usually are highly intelligent. And with my own twins, one of them has a dyslexia dyscalculia and the other one doesn't. And they both have brilliant brains, but one of them just thinks very, very differently than the other. And, she's improving, actually, her dyslexia is far better. But they think differently. And actually, that's where the whole process of education, different people think and learn in different ways. Different people need more visual stimulation, more conceptual stimulation. Different children's brains, and we all do, all of us learn in different ways. That's why we need different mediums of learning. And I think education it's hard to treat children who all learn in different ways. And the education system is very biased in certain directions, and it's difficult. And I'm hoping in the future that it will be very different. So different types of learners can learn in a way that suits them. But actually, the behavioural, because actually some of these children can have behavioural problems, but that's mainly out of frustration and stress. And so it's very important to discern and decipher what is dyslexia, because actually you have a child, when I was at school, there were kids who were dyslexic, but they were classified as not very clever. And that is just nonsense, actually. They just had difficulty with reading and writing and expressing, and sometimes in different ways. And thank goodness now there is more of a diagnostic kind of prevalence, not all the ways though, which can allow people to actually compensate to some degree some of these difficulties. The system has a long way to go, in my view. But you can grow out of it, and treatment can help remove it. My other daughter has no sign of dyslexia at all now, and she had a strong dyslexia when she was 8-9 years old, diagnosed very clearly, but she has no sign of it now. So it's an interesting thing that some kids can grow out of it, some can, with treatment, regular treatment, minimalize it. There are specific ways of learning where you start linking letters and sounds. That's a very good way of learning to kind of get beyond this. Neurodevelopmental therapy is very, very good for supporting children. I always like the idea of a multiple approach to maximize. Again, it's all about maximizing a child's potential. Removing blocks is what I'm all into. And the more blocks you can remove, the more they can really express themselves fully. Anyway, I hope that's of some help. It's important I think, to get it diagnosed, because there are things that can be done, and to pick up these things younger is better, always, because there are things that can be done, and children can be helped. Okay, I wish you well.